Respiratory rate is the number of breaths taken within a set amount of time, typically 60 seconds, measured by counting the number of times the chest rises. Respiratory rates changed based on many health and activity factors. Normal respiratory rates also differ in adults and children. The respiratory rate is the number of breaths someone takes every minute and is one of the main vital signs, along with blood pressure, pulse, and temperature. When a person inhales, oxygen enters their lungs and travels to the organs. When they exhale, carbon dioxide leaves the body. A normal respiratory rate plays a critical role in keeping the balance of oxygen and carbon dioxide even. Although the normal respiratory rate can vary slightly between individuals, there is a range that doctors and nurses considered usual. The normal respiratory rate for healthy adults is between 12 and 20 breaths per minute. At this breathing rate, the carbon dioxide exits the lungs at the same rate that the body produces it. Breathing rates of below 12 or above 20 can mean a disruption in normal breathing processes. To determine whether a person's respiratory rate is normal, it is essential to measure it at rest. Remember, exercise or even walking across a room can affect a person's respiratory rate. To take an accurate measurement, watch the person's chest rise and fall. One complete breath comprises one inhalation when the chest rises, followed by one exhalation when the chest falls. To measure the respiratory rate, count the number of breaths for an entire minute or count for 30 seconds and multiply that by the number 2. An area at the base of the brain controls breathing. The brain sends signals from the brain to the breathing muscles. Breathing mostly occurs automatically, which means a person does not have to think about it. Sometimes the body needs to adjust the breathing rate. Receptors in the brain detect low oxygen or high carbon dioxide that send signals to the body, which can change the breathing rate. Having an abnormal respiratory rate can indicate a variety of things. In some cases, a high or low respiratory rate is due to an activity, such as exercise, and is not an indication that there is anything wrong. Sometimes, however, various diseases, injuries, and substances can lead to a change in breathing. In a medical setting, an abnormal respiratory rate, especially if it is too fast, can indicate a health problem. One study involving over 15,000 people who had visited the emergency department indicated that a high respiratory rate was a predictor of worsening medical problems after discharge. People who had a higher breathing rate returned to the hospital more often than those with a normal breathing rate. There are various factors that affect a person's breathing rate, including injuries, exercise, emotion, mood, as well as range of medical causes. Common causes of high respiration include anxiety. People may breathe faster when they are afraid or anxious. Fast breathing or hyperventilation is a common symptom of panic attacks. The fast breathing will usually pass once the anxiety goes away. Fever. As the body temperature increases with a fever, respiratory rate can also increase. The increase is the body's way of trying to get rid of the heat. Respiratory diseases. Various lung diseases such as asthma, pneumonia, and COPD can make it difficult to breathe, which can lead to an increase in respiratory rate. Heart problems. If the heart does not pump properly to get oxygen to the organs, the body may react by breathing faster. Dehydration. Dehydration can increase breathing rate as the body tries to get energy to the cells. Factors that can cause a low respiration rate include a drug overdose, such as narcotics, can depress the breathing drive in the brain, leading to low respiration rates. Obstructive sleep apnea. Sleep apnea involves a blockage of the airway, often due to relaxation of the soft tissues in the throat. The blockage causes brief pauses in breathing and may decrease overall respiratory rate. Head injury. Head injuries can affect the area in the brain that plays a role in breathing, which may cause low respirations. A mild variation from normal respiratory rate may not be a cause for concern, but in some cases, a respiratory rate that is too high or too low can be a sign of a medical problem. If respiratory rate is very abnormal, or if a person has signs of infection, such as fever, fatigue, or a sore throat, they may benefit from seeing a doctor. People that have lung diseases, such as emphysema, asthma, and chronic bronchitis, may also want to see a doctor if their respiratory rate is abnormal. It can be a sign that their lung disease is worsening. See immediate assistance if any of the following is present: chest pain, bluish skin, gurgling sounds during breathing, and breathing very few breaths per minute. A normal respiratory rate varies based on age and activity levels, but various conditions, including illnesses and injuries, can also lead to a breathing rate that is too high or too low. It is important to take an accurate measurement of respiratory rate to determine whether or not it is abnormal. In some instances, an abnormal breathing rate can be an indication of an underlying medical issue, which requires treatment. The normal respiratory rate for a healthy adult rests at 12 to 20 breaths per minute. You will count the number of breaths a person takes in 1 minute. This should be done when the person has been at rest for at least 5 minutes. Simply watch the rise and fall of the person's chest when the person is not aware that you are taking the respiratory rate. It is not unusual to get erroneous resting respiratory rates when the person knows you are assessing their breathing. Count the respiratory rate of your subject once they have been in the seated resting position for more than 5 minutes. Count the rise and fall of the chest or shoulders for 30 seconds and multiply that number by 2. You can conduct 3 total trials and record the mean. A stethoscope is an acoustic device used for hearing breathing sounds and for taking blood pressure. Sound is amplified by the bell and diaphragm at the end of the tubing of the stethoscope. The diaphragm amplifies high-frequency sounds, like respiratory sounds, and the bell amplifies low-frequency sounds. The ear tips should be directed into the ear canal and slightly forward-facing. After assessing respiratory rate, use the stethoscope to perform auscultation of your subject's lung sounds. Use the diaphragm to listen to your client's lungs through their shirt. Have them inhale and exhale deeply through the mouth. Listen for any abnormal noise, crackling or wheezing, and note it for the appropriate quadrant.